The ICU is full of instruments, monitors, and sounds that may appear confusing and complicated. This video will help you understand what you're seeing. The monitor in the room provides the ICU staff with important information about a patient's heart rate, blood pressure, and other vital signs. The ICU team is always able to see the information throughout the unit, even if they are not in the room. Much of the equipment in the ICU will make noise or may sound an alarm. Some alerts may be serious and require immediate attention. Others may not. Alerts and alarms are specific to each patient. Please talk with your bedside nurse if you have any questions about alarms. In the ICU, there are many common procedures and types of equipment that are used to treat patients. The arterial line is a small plastic tube inserted into an artery to continuously measure a patient's blood pressure. It can also be used to measure oxygen levels in the blood. A central line is a small plastic tube inserted into a large vein to administer medications and can be used to measure the pressure within the heart. Some medications can only be safely given through a central line. Intubation is a placement of a tube into a patient's body. The most common use of this is to place a breathing tube into a patient's airway, also known as an endotracheal intubation. Endotracheal intubation is necessary when patients can no longer cough and clear secretions or adequately breathe on their own. A ventilator is a machine that helps a patient breathe. It is used whenever a patient cannot adequately breathe on their own and requires assistance. Due to a critical illness or injury, patients may not be able to eat. A feeding tube is a way to administer complete nutrition to help a patient's healing process. If patients are unable to receive nutrition through a feeding tube, then they can be fed through a central line. Patients in the ICU who are able to eat and drink may still have restrictions on what they can consume. Please check with your nurse before consuming or giving any water or food. Some patients require special precautions to protect them and you from the spread of germs. Isolation care is used when germs are detected that can only be treated by a limited number of antibiotics. It is very important not to spread these germs to other people, and isolation care was developed to limit the chance of their spread. Healthcare workers may wear a mask, gown, and gloves when in the room, and you may be asked to do the same. When a patient is receiving isolation care, anyone entering the patient's room may also be required to wear a special gown, gloves, or a mask. Talk with your nurse with any questions about isolation precautions. Thank you for watching this video. Hopefully, you've learned more about the sights and sounds of the ICU. It is a lot to take in, so we don't expect you to remember everything. If you have any questions, we encourage you to ask when you don't understand what's happening or if you have concerns.